Back sleeping. Back sleeping is the most structurally aligned position your body can achieve during sleep. What makes it remarkable is that it's the only position where your spine maintains complete neutral alignment from skull to tailbone without compensation. Your weight distributes across your body's largest surface area, creating minimal pressure points while your internal organs rest in their natural anatomical positions. Your spine's natural S-curve maintains proper positioning when you lie supine with appropriate pillow support. Your diaphragm expands freely, your ribcage moves without restriction, and your facial skin experiences zero compression, preventing sleep wrinkles. However, gravity simultaneously pulls your tongue and soft palate backward toward your throat, creating partial airway obstruction for many people. This position increases snoring by 75% and elevates sleep apnea risk significantly. Evolutionarily, back sleeping represented safety and security. Early humans who slept face up exposed their most vulnerable areas, throat, chest, abdomen, to potential threats. This position was reserved for defended caves or protected camps where deep, restorative sleep could occur without maintaining defensive readiness. Approximately 15% of adults primarily sleep on their backs, though respiratory conditions and acid reflux often force people to abandon this position despite its structural benefits. Side sleeping. Side sleeping is humanity's most common sleeping position, adopted by approximately 60% of adults worldwide. What makes it remarkable is that it simultaneously keeps your airway mechanically open, facilitates brain waste clearance, and protects your vulnerable anterior body surface. Your spine creates an S-curve with 60–70% of your body weight concentrated on your shoulder and hip. This position transforms your internal anatomy based on which side you choose. Left side sleeping positions your stomach below your esophageal opening, leveraging gravity to prevent acid reflux while keeping pressure off the vena cava, the major vein returning blood to your heart. Your airway remains open because your tongue can't fall backward into your throat, reducing snoring by approximately 50% and sleep apnea episodes by 75%. Your glymphatic system, the brain's waste removal network, functions 60% more efficiently in lateral positions, clearing metabolic byproducts more effectively during sleep. Evolutionarily, side sleeping emerged as the optimal balance between protection and function. Early humans protected their ventral surface while maintaining the ability to quickly push to standing. The position allowed mothers to cradle infants while monitoring the environment and reduce the body's visible profile compared to back sleeping. However, this position creates concentrated pressure on shoulders and hips, often causing pain and restricted circulation, and requires precise pillow height to prevent neck strain. Fetal position. Fetal position is humanity's most common sleeping position, adopted by approximately 41% of adults worldwide. What makes it remarkable is that it recreates our first physical orientation, the curved, compact shape we held for 9 months in the womb. This position combines side sleeping with flexion, knees drawn toward chest, spine curved forward, body compacted into roughly 70% of its extended length. Your spine curves into flexion, while your hip flexors shorten and shoulders roll forward, creating a protective shell around your vital organs. This position dramatically reduces your body's exposed surface area by approximately 30%, making it naturally preferred in cold environments. Your limbs draw inward toward your core, creating a compact, defendable perimeter. However, this compaction compresses your diaphragm from below, potentially reducing lung capacity by up to 10%. Your breathing becomes shallower, and your hip flexors remain shortened for hours, creating morning stiffness. Evolutionarily, fetal position represented maximum protection combined with heat conservation. Early humans without clothing or enclosed shelter needed to minimize heat loss during sleep. The curled position reduced surface area significantly while shielding vital organs from frontal attacks. The position enabled rapid protective responses and provided psychological comfort through environmental uncertainty. Women adopt this position 10–15% more frequently than men, and the rate increases during high-stress periods by 15–20% across populations. Stomach sleeping. Stomach sleeping is the most structurally problematic position, yet persists in approximately 7% of adults worldwide. What makes it remarkable is that despite creating extreme spinal stress, people maintain it because it's so effective for reducing snoring. Your neck rotates 80–90 degrees to one side for 6 to 8 hours, while your lower spine hyperextends as your pelvis sinks into the mattress. Your chest and abdomen press against the sleeping surface, requiring your respiratory muscles to work harder with every breath. Your ribs can't expand freely backward because the mattress blocks them. However, your airway remains completely obstruction-proof. Your tongue physically cannot fall backward into your throat, and your soft palate can't collapse into your airway space. For severe snorers and certain sleep apnea patients, this mechanical airway protection feels worth every structural compromise. Evolutionarily, stomach sleeping represented extreme vulnerability with limited benefit. Early humans sleeping face down, exposed their entire back to attack, couldn't see approaching threats, and couldn't quickly rise to defensive positions. The only evolutionary advantage appeared in extreme heat environments, where maximizing body contact with cool surfaces provided temperature regulation. The rate peaks at 18-22% in young adults aged 18 to 30, then drops sharply to just 3 to 4% by age 60 as accumulated joint wear makes the position untenable. Starfish pose. Starfish pose is the rarest natural sleeping position, adopted by only 5% of adults worldwide. What makes it remarkable is that it requires complete environmental security and maximum bed space. Your limbs spread outward in all directions, arms raised above your head, legs extended and separated. It's humanity's most vulnerable yet most symmetrical sleeping position. Your arms stretch upward and outward, while your legs extend fully and separate, creating an X or star shape. Your spine maintains neutral alignment, with completely balanced loading. Left and right sides experience identical pressure and positioning. Your chest opens wide, shoulders roll back naturally, and your ribcage expands freely in all directions without limb compression. There's no compression anywhere, allowing your muscles to release all holding patterns and your lymphatic system to drain efficiently without compressed pathways. However, arms raised above your head can compress the brachial plexus and subclavian artery, causing numbness or dead arm sensation. Like all back sleeping variants, your tongue and soft palate can collapse backward, making snoring likely. Evolutionarily, starfish pose represented the ultimate luxury of safety. Early humans could only adopt this position in environments with zero threat. The position eliminated defensive capability entirely and required personal space that early humans rarely possessed. It's most common in young adults aged 18 to 30, then decreases with age as joint pain makes limb extension uncomfortable. Yearner pose. Yearner pose is adopted by approximately 13% of adults worldwide, combining the benefits of side sleeping with distinctive arm positioning. What makes it remarkable is that it actively opens your shoulder joints while maintaining lateral orientation. Your body lies on its side, but your arms stretch forward as if reaching for something just beyond grasp. Your body creates the same S-curve through your spine that all side positions share, but your extended arms pull your shoulders forward and open, creating space in your shoulder joints and distributing some weight forward. Your chest rotates slightly forward compared to standard side sleeping, opening your rib cage more and allowing easier breathing. This arm extension prevents you from curling too tightly into fetal position while maintaining all airway advantages of side sleeping, reduced snoring, improved brain waste clearance, and better breathing efficiency. The forward arm reach allowed early humans faster. Pushing to standing arms were already positioned ahead of the torso, ready to press against the ground for rising. It maintained side sleeping's organ protection while preventing deep compression of tight fetal position. The extended arms could respond more quickly to threats while allowing protective awareness of children or partners in group sleeping arrangements. The rate increases with age. Only 8% of young adults sleep this way compared to 15% of middle-aged adults, suggesting people discover this position's benefits after experiencing shoulder pain from standard side sleeping. However, if arms extend too far forward, they can experience circulation restriction and nerve compression, causing that pins and needles, dead arm sensation. Your sleeping position is an unconscious negotiation between comfort and consequence, a nightly choice between breathing efficiency and spinal alignment, between psychological security and physical freedom. It's an evolutionary inheritance that balances survival instincts against modern comfort. Which position do you naturally wake up in, and have you noticed how it affects your morning energy? Drop your sleep style in the comments. Subscribe for more insights that decode what your body is telling you. Don't just sleep through life, understand it.